Wellness Incentive Program, Smoking Cessation by Africa, Lindsay and Samrin. Smoking Cessation Program, Cessation Goals. OSH, Ontario Health and Safety, amplify resources and activities that support people in quitting tobacco. OSH activities align with three overarching goals. Develop and share tailored and targeted cessation resources. Increase the reach of cessation interventions and the use of cessation treatments among high prevalence population. Improve engagement with health systems in order to advance the integration of cessation-related clinical care. Objectives. Number 1, protect the health of employees who are the asset of the company. Number 2, prevent occupation-related diseases. 3, curb spending, increase medical spending of the Health Insurance Society. 4, aim at reducing costs attributable to smoking. Number 5, take the initiative in fulfilling social responsibility in order to protect environment. Why cessation is important. Tobacco use is the leading cause of preventable disease, disability, and death. While quitting may be difficult for some, it is possible. Cessation, a key component of a comprehensive approach to prevent and reduce tobacco use. Cessation is one of 4 impact areas that serve as foundational pillars of smoking and health work. Smoking shortens a smoker's life by 10 to 14 years. If they stop before age 40, smokers reduce their risk of dying from smoking-related diseases by 90%. Illnesses, conditions associated with smoking. Smoking increases the chances of developing 50 different diseases. Number 1 cause of preventable death in the world. Tobacco users are at high risk of asthma, bleeding in the brain, breathing problems, cancer, diabetes, heart attack, high blood pressure, infections, nerve damage, stroke, tooth loss, and many more. Program design and development. Designs for food manufacturing company. In the smoking area, smoking is not allowed in the workplace but permitted outside the work area. There are active and passive smokers, affecting health conditions and decision-making power. The WELL Steps Engagement Model. Maximize wellness engagement. Effective marketing, wellness committee, small incentive swag, leadership support, communication channels, benefit-based incentives. And the design, pre-contemplation, contemplation, preparation, action. Action is biometric screening, HRA, coaching, wearables, challenges, campaigns, competitions, presentations, classes. And then maintenance, maintaining healthy behaviors. That is the WELL. And then we're going to go to model. Awareness literature, counseling, nicotine gum alternative availability, fitness check, seminars on the wellness program, cessation insurance coverage, helpline, surveys. Targets: tailored and targeted cessation resource, addressing high prevalence populations, health systems, clinical improvement. Focus: there are 6 main reasons for employers to support smoking cessation in the workplace: improve employee health, increase productivity, reduce cost, enhance job satisfaction, effective setting, better corporate image. And then we're going to go to implementation. Awareness literature. Printable pamphlets in lunchroom and offices. Warning and health risks on notice board and smoking areas. Informational videos. Sharing success stories how to quit smoking. Counseling. Monthly supervisor meeting. Awareness sessions with young age employees. Sharing links of motivational speaker, example TED Talk. Joint Health and Safety Committee members should be available for counseling session. Fitness check. Mostly people are hired through agency. Employees are hired by taking their physical examination. This program includes lifting, pushing, pulling, and coordination of hands. The tests also check the heartbeat rate, helpful to get to know the physical and heart conditions. Cessation insurance coverage. The Ontario Drug Benefit Program provides reimbursement in drugs if you are 18 years old or older. Treatment of each is limited to 12 weeks. STOP program. Ontarians can access limited NRT. The meaning of NRT is nicotine replacement therapy through workshop hosted across the province. Helpline. Eligibility to receive free nicotine replacement therapy. Call 905-358-5552. For information on quitting smoking, the law on secondhand smoke, email the tobacco hotline or call 905-688-8248 extension 7393 or 1-888-505-6074 extension 7393. The Ontario Drug Benefit includes coverage to help you quit smoking. Supervisors and Joint Health and Safety Committee members are available if someone don't want to show up. Their identity. Number for contact available on notice board of the company. Counseling and support groups by government. Talk to your doctor about getting individual counseling or joining a support group. You can also contact your local public health unit. Visit Health 811 online or call 811 for support. Visit the Smokers Helpline website. Incentive for employee. As they progress and have more and more success, they build points and earn a larger benefits-based incentive such as discount on their insurance premium or lower co-pay or deductible. The small short-term incentives provide immediate rewards for wellness program participation, such as completing a personal health assessment, biometric screening, or a behavior change campaign. The best way to do this is to start with the motivators, short-term, small incentive like gift cards or t-shirt. Surveys. Using health and productivity surveys on an ongoing basis can begin to evaluate the return on investment of offering tobacco use cessation program on employee absence or productivity. These surveys may be proprietary and may require a modest fee to use. Two examples are provided below: Health and Work Performance Questionnaire, Work Limitations Questionnaire, survey conducted by Joint Health and Safety Committee to collect data. Monitoring. Metrics for worker productivity, healthcare costs, health outcomes, and organizational change allow measurement of the beginning baseline, middle process, and the result of workplace health programs. In general, data from the previous 12 months will provide sufficient baseline information and can be used in establishing the program goals and objectives in the planning phase and in assessing progress toward goals in the evaluation phase. Worker productivity. Reassess. The process is reassess the average number of sick days per employee at the first follow-up evaluation, and then periodic repeats of other baseline measures. Healthcare cost. The process changes in healthcare use and cost from baseline. Assess changes in the number of employees who utilize tobacco use treatment. Compare healthcare use and cost of participants in programs for tobacco cessation. Tobacco smoking increases the risk of heart attack, stroke, lung cancer, deaths, and other serious health outcomes. These are the end-stage result of smoking, and measurable differences may not be seen for several years. For this reason, it is important to measure earlier outcomes such as the number of employees who quit smoking or decreases in sick days. Health outcome. Assess changes in employee levels of tobacco use such as changes in the number of employees reporting tobacco use or exposure to secondhand smoke before and after the tobacco cessation campaign or program, changes in the frequency or duration of employee exposure to secondhand smoke, increases in number of employees who remain tobacco-free for 6 or more months, increases in the number of quit attempts made by the employees. Organizational outcome. Document steps taken and progress toward implementing each intervention selected. Reassess employee satisfaction regarding workplace suggested tobacco cessation program. Non-taxed employee counseling. Employee counseling services are not taxable if they are for one of the following: an employee's re-employment, an employee's retirement, an employee's mental or physical health, such as counseling for tobacco, drug, alcohol abuse, stress management, or employee assistance programs, or that of person related to an employee. Cost analysis. To calculate the return of investment, ask how much money was saved or earned after the program was implemented for every dollar spent on employee wellness. May not be able to put a monetary figure on the result achieved. Take value and investment (VOI) approach. Value and investment, VOI, productivity, engagement, healthcare spending, employee turnover and higher retention rates, talent acquisition, health metrics. Return on investment, cost per employee per year. Statistics Canada stated that yearly employee absenteeism rates range from 4.7 days to 11.2 days. This is a significant reduction. In fact, it translated into estimated savings of $251 per employee each year. Wellness programs help reduce absenteeism by 1.5 and 1.7 days per employee each year. Reference: in 2011, a strategic alliance called the Canadian Return on Investment Study launched new research as part of a two-phase multi-year study of workplace wellness and ROI. That's all, and thank you. Do you have any questions? No questions. Thank you.